Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19, infection control, and other nursing home-related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. My name is Kathy Caudill. I'm a communications specialist with Quality Insights. Today's webinar is Hand Hygiene, Healthy Hands for Healthcare Workers. Everyone has entered the meeting on mute, but we will have a Q&A following the presentation. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We invite you to join us every Wednesday for more of our weekly webinars. Next week's topic is antibiotic stewardship in long-term care. If you're interested in joining, that will be the same time and place next Wednesday at 2 p.m. And now I'd like to introduce our guest today, Ericka Bolyard. Ericka is the Northern Regional Infection Preventionist with the West Virginia Department of Health and is a part of the Healthcare Associated Infections Antimicrobial Resistance Program. With 17 years of experience in infection prevention and control, she brings a wealth of knowledge and expertise to helping facilities in her region. She has been an infection preventionist in many settings, including long-term care, home health, and hospice. Ericka holds a Bachelor of Science in Nursing from West Virginia University and is a registered nurse and has a Master of Science in Nursing from Chamberlain University. She has achieved the National Long-Term Care Certification in Infection Prevention and is an active member of the West Virginia Association for Professionals in Infection Control and Epidemiology. Ericka, thank you for joining us today.
Thank you. Hello, everyone. I'm so glad you could join me for today's presentation on hand hygiene, healthy hands for healthcare workers. Hand hygiene is one of the most important ways to prevent the spread of infection, so it is always good to refresh on this topic. So for today's agenda, we will be talking about ways to keep your hands healthy, keeping your hands clean, encouraging others to have clean hands, and there will be time at the end if anyone has any questions. So, keeping your hands healthy. Hand hygiene in healthcare. What do we mean when we say hand hygiene? Simply keeping your hands clean. By doing this, you're protecting yourself and those receiving care from you. It also prevents the spread of germs because healthcare workers are what make germs mobile. Hand hygiene begins with healthy hands, skin, and nails. I want you to ask yourself, how have my hands changed since I began working in healthcare? Feel free to drop some answers in the chat if you can think of some. I can tell you from my experience, my hands were always getting super dry to the point of hurting, which takes us to our first topic. Challenges in hand health. Contact dermatitis, which is an inflammation of the upper layer of the skin resulting in dryness, redness, itching, cracking, blistering, and pain. Healthcare workers are prone to this because of the frequency we come in contact with irritants associated with our frequent hand hygiene. So irritants such as water. I've been to a lot of places that have hard water, which may contain excess minerals that are not friendly to our hands. Friction, repeatedly rubbing our hands together. Gloves. I've never met a nurse who didn't have a favorite type of glove because how they feel on their hands. Disinfectants can be harsh on our hands. Allergens, such as rubber accelerators. If you don't know what rubber accelerators are, these are the chemicals they use to speed up the process when making rubber, which can be used in the production of gloves. I'm sure everyone has worked with that person that had to have their own box of gloves because they couldn't wear certain kinds. Chlorhexidine gluconate, which is an antiseptic agent used to prep for surgical procedures, but some people have an adverse reaction to it. So how do we keep our hands healthy, especially with the amount of times we are required to perform hand hygiene in healthcare setting? So use alcohol-based hand sanitizer. We have come a long way with this product, and a lot of companies are now putting skin conditioners, essential oils, or something in it to help our hands. Make sure you are using a facility-approved hand moisturizer, or hand moisturizers, yes. Not Bath and Body Works or some other product, but a lotion that should be evaluated for the compatibility with the alcohol-based hand sanitizer or other antiseptics used in your facility. So if your hands do become irritated, cotton glove liners can be used to provide a layer of protection under other gloves. But then you have to consider guidance that you have to follow for their laundering and discarding. Nails. So I'm not a popular person when I bring this topic up during infection prevention assessments, but nails should be short and natural, no artificial nails. Germs can live under artificial fingernails both before and after using alcohol-based hand sanitizer and hand washing. Your nails should be no longer than the fingertip. So I'm a firm believer of practicing what I preach. So my nails are exactly what I've told you here. And lastly, scrubbed surgical personnel should not wear nail polish. This can reduce the effectiveness of surgical scrubbing, and bacteria can get trapped in microscopic imperfections of nail polish. So keeping your hands clean. When should we clean our hands? Immediately before touching a patient, before an aseptic task such as handling an invasive medical device, after contact with blood, body fluids, or contaminated surfaces, after touching a patient, after touching the patient's environment, before moving from work on a soiled body site to a clean body site on the same patient. I can tell you from my experience and all the hand hygiene audits I've done in my career, that is the hand hygiene opportunity that gets missed the most. And lastly, immediately, not when you get back to the nurse's station, immediately after glove removal. In addition, wash hands when visibly soiled before eating and after using the restroom. So keeping our hands clean with alcohol-based hand sanitizer. This is the preferred way to clean hands when they aren't visibly dirty. And I know my coworkers chose me to do this presentation because at any given time, I have 5 alcohol-based hand sanitizers on me when they ask, because I love alcohol-based hand sanitizer. So this requires less time and is more accessible than sinks. It is also more effective at killing potentially deadly germs on hands than soap. It is also less irritating to skin than soap and water. So alcohol-based hand sanitizer technique. Technique matters when cleaning your hands. It only counts if you use the right amount the right way. So make sure you get enough product on your hands before you start rubbing them together. Just like technique, the amount of product you use matters. I can't tell you how many times I've seen what I call quick hand hygiene, where they get the product on their hand and they rub their palms together and they go. So thinking that was sufficient enough hand hygiene. But you want to make sure you are covering all surfaces, including your fingertips, fingernails, and underneath those fingernails. Sometimes healthcare providers get in that habit and they miss those areas. They should continue rubbing their hands together until they feel dry. I will see staff who rub their hands together and then they give them a good shake as they walk down the hall because the product's not dry. And all this should take at least 15 seconds. Also, if your staff are carrying individual pocket-sized dispensers, I would make sure they know how to use them properly to not contaminate their hands while cleaning them. So, for example, I have my alcohol-based hand pocket sanitizer here. They want to take the container out of their pockets because they're keeping them in their pockets, which is dirty. Hold it in one hand, make sure they dispense enough gel or foam to cover both hands into the other hand. Close the lid and store the container back in their pockets. My slide changed. Back in their pockets before rubbing their hands together. Rub for approximately 20 seconds, coating all the surfaces of both hands until the hands are dry. Then they can go directly to the patient or residents without putting hands back in their pockets or touching anything else. Also, make sure you're using the right kind of alcohol-based hand sanitizer. So the CDC recommends 60% to 95% alcohol in the product that you choose. So when to use alcohol-based hand sanitizer? All the same moments I mentioned earlier, but it is always good to see them again as a reminder. I've been places where they tell me, yes, all of our staff know how to do hand hygiene. We do competencies on every single person and they demonstrate it to us. That is all great. But did you tell them when they're expected to do that? And they'll be like, I I don't think we did. So let's talk about the hand hygiene moments. So in fact, missed opportunities for hand hygiene can be as high as 50% because healthcare personnel do not clean their hands at these moments. So let's talk about soap and water. Effective use of soap and water only achieved with thorough technique. So make sure to focus on cleaning hands at the right times, which I'm going to discuss here in a minute. So when using soap and water, we don't always know how many organisms are left behind when our hands are washed. I want to point out the statement at the bottom of the slide that says hand washing may not remove all bacteria when dealing with C. diff. So although there is a theoretical advantage to cleaning hands with soap and water when caring for patients with C. diff, um, C. diff still CDC still indicates, got a little tongue twister there. CDC still indicates a preference for alcohol-based hand sanitizer, as studies have not shown a clear prevention benefit for soap and water. And removing the alcohol-based hand sanitizer risks reducing hand hygiene compliance overall. So now you might be asking yourself, well, what am I supposed to do when caring for a C. diff patient? You can use alcohol-based hand sanitizer before patient care, but when entering the room, the priority should be to ensure glove use, in addition to the gown, and proper technique when removing gloves to minimize the risk of self-contamination. So current evidence demonstrates that C. diff spores may not be fully removed from hands, regardless of the method used to clean the hands. So this further emphasizes the need for appropriate use of gloves for the care of patients with C. diff. Hand washing technique. Make sure you wet hands with water. I like to avoid using hot water to prevent drying of the skin. Apply hand wash to hands. Rub hands together vigorously for at least 15 seconds. The time it takes is less important than making sure all areas of your hands are clean. Make sure to cover all those surfaces of the hands and fingers. Rinse hands with water. Use disposable towels to dry, and then use another clean, dry towel to turn off the faucet. So when to clean hands with soap and water? It's okay, Ashley. When hands are visibly soiled before eating. I like that one. I like going to infection prevention conferences and where they give us lunch and then they're like, let's go eat. And then everybody goes straight to eating and does not wash their hands with soap and water. And I'm like, guys, before feeding a patient or resident, after using the restroom, after assisting with toileting, and any time caring for a person who has or might have infectious diarrhea. So gloves. It is the best defense against hand contamination. Hands must be clean after taking the gloves off. Glove use is not a substitute for cleaning your hands. Dirty gloves can soil your hands. Use gloves when you might encounter blood or body fluids. Have you ever been in a situation where you thought, I wish I would have put gloves on? Hopefully not, but I have seen it happen. When to wear gloves. So, wear gloves when there is an anticipated contact with blood, mucous membranes, non-intact skin, a patient or resident on contact precautions, handling soiled items and surfaces, or equipment used for invasive procedures. So there was a study done completed on most frequently touched items by CNAs in long-term care while wearing contaminated gloves. This graph shows the results. On the side, you have the number of contaminated touch points. So they define touch points as occurring when a CNA failed to remove gloves immediately, either after touching a surface potentially contaminated with patient blood secretions or excretions, or failed to change their gloves, or to perform hand hygiene between caring for different patients and continued to touch surfaces. So over the study period, 74 CNAs and 2,213 touch points were observed. So contaminated gloves touched wipes or packages most often. Does anything surprise anybody about these results, or the contaminated touch points or what was touched most often with contaminated hands. If you want to tell me if anything surprises you, I'd be interested to see it in the chat. I guess the thing that surprised me the most from this results was the door being the lowest. I've seen a lot of contaminated gloves touch doors and door handles in my experience, but that was the one that kind of surprised me as being only 10 contaminated touch points for the door. The do's of glove use. So clean hands before putting on gloves, immediately after removing gloves. Change gloves when they are damaged, moving from contaminated body site to a clean body site. When gloves look dirty or are visibly soiled after completing a task, and moving from one patient to the care of another. And you want to make sure to remove them in a way that does not contaminate your hands. And wearing 2 pairs of gloves does not prevent hand contamination when gloves are removed. I still see it out there. They think 2 pairs of gloves works, but it does not. The don'ts of glove use. Do not try to clean disposable gloves. I've seen people try to put alcohol-based hand sanitizer on their disposable gloves. Alcohol-based hand sanitizer will ruin the integrity of the glove. It's not what disposable gloves are made for. So never wear the same pair of gloves in the care of more than one patient, and do not wear 2 pairs of gloves unless it is specifically indicated for your role, because there are some, like for example, pharmacists making certain medications are required to wear 2 pairs of gloves. Encouraging clean hands is a team effort. So, common barriers to clean hands. I want everyone to think of some barriers you have personally experienced when considering hand hygiene in your workplace. One that I have, lack of access to supplies. So alcohol-based hand sanitizer being located away from point of care. I'm still going into facilities where they do not have alcohol-based hand sanitizer available in patient rooms. Also make sure dispensers are not blocked. When doing assessments, I'll ask staff, where's the alcohol-based hand sanitizer? And they'll point, but it might be blocked by wheelchairs, lifts, tables, something else. So they are unable to use it. Alert the correct person about needed supplies. Do you know who to contact when supplies for hand hygiene are needed? Also report non-functioning dispensers as quickly as possible. Gloves, not a substitute for hand hygiene. Time pressure, slow down, focus, be aware of surfaces you touch. My husband doesn't like to take me to certain places because sometimes it's really hard to shut my infection prevention brain off, and I start counting potential transmission risks in public. So be aware of the surfaces you touch. So now I have a short video I would like to share with you on the 4 E's of an effective hand hygiene program. This is a 4-video series by the CDC, but I want to focus on the 3rd E, which is execute, mindfulness and team accountability with hand hygiene. I'm going to stop sharing so Catherine can.
All right, thank you, Erica. I'm gonna pull that up right now. And I saw that we have some questions in the chat, and I just want to let you guys know that we see them, and we will get to those here in a little bit. And let me know if everybody can hear the audio of the video. Okay.
I can't hear it.
Oh, I just somehow I went away from the video. Let's try to get back to it. Nope, Chrome crashed again. Okay. I don't think we're gonna be able to do the video, everybody. Sorry about that.
Sorry, it is
Yeah.
good to go look at the 4-video series by the CDC with the 4 E's for hand hygiene. So it's good to look at. Is my screen back?
Yes, it is.
Okay. So what the video mainly goes over is providing accountability and feedback. And you can provide feedback in a positive way versus a negative way. So it kind of goes over that and how to address people if you see issues with hand hygiene. So keeping hands clean is a team effort. And I don't know what happened to this slide. I think I was supposed to put my team on there, but I couldn't do it. So it's not all on the infection preventionist. It is a multidisciplinary and it's everyone's job. So does anyone have any creative ways that you might encourage people to clean their hands? I like hearing other people's ideas. Feel free to drop some ideas in the chat. I'm always learning. I don't pretend to know everything, and looking for ways to make hand hygiene fun. So the video was meant to be the end of the presentation. We will take questions, but how to get involved and feedback, I have some resources there and additional resources for hand hygiene if we want to, if you want those links as well.
All right, thank you, Erica. So we do have some questions in the chat. One question says, are you saying that sanitizer is recommended over soap and water for C. diff?
So the CDC won't take a stance on that. So they're saying to not rule out one or the other. Like use alcohol-based hand sanitizer before patient care, before going into the room, but they're really focusing on the PPE use and the glove use and making sure you're not contaminating that, but then doing the hand washing when you're leaving the room. So they won't, so they don't want to take the hand, because people used to cover alcohol-based hand sanitizer machines back in my day working the floor, when a patient had C. diff, but then the CDC realized in studies that just really decreased the overall, percentage of hand hygiene.
And we had another question that was pretty similar. It says, I've always been told that ABHR is not effective when working with someone that has C. diff. Is this inaccurate?
Yeah, it's kind of along the same lines. In the studies that the CDC has been doing, they can't prove that any method of hand hygiene completely destroys all the spores associated with C. diff. So that's why they're basically saying use both. Alcohol-based hand sanitizer before, washing your hand with soap and water after, but use that PPE, the gloves and the gown for C. diff.
Next question in our Q&A says, cotton glove liners, are they reusable or one-time use?
There's different ones out there, so it could be either or. That's why I said whichever one that you would get, look at the manufacturer guidelines for the disposal and use, and if it is reusable, they can be laundered, but that would all be in the manufacturer guidelines of the cotton glove liners.
Someone, I think, had a tip. They said, our hospital had a hand washing program. If someone failed to wash their hands, we used a term, for example, George, rather than embarrass the person. It was brilliant and improved our outcomes.
That's awesome. Yeah, because like the video that I was trying to show does kind of, cover some of that. When somebody fails to do hand hygiene or use the correct amount or something, you want to try to address them one-on-one and not embarrass them or call them out in front of their peers. And the video does highlight that, so please check that out.
Someone said using fluorescent gel and black light is effective to demonstrate hand hygiene. I like to use it with those with longer nails, etc.
That's why I said I'm not a popular person. I know nurses love their nails, and I've had people tell me that they refuse to put anything about fingernails in their policy because they're afraid to lose staff because people love their nails so much. And that's why I said short. That's why I always address nails and hand hygiene and let the facility choose their stance.
And we had some responses in the comments to your earlier questions early on in the presentation, asking about like the dry cracked hands. Someone said dry and cracked hands from frequent washing. I can't stand the portable stations. And then she also said that she doesn't like the alcohol-based hand sanitizer and that it's irritating to her skin.
I know there's a lot out there that are very harsh on your hands. That's why I said that companies are trying to help our poor hands by putting extra stuff in them now, because they did realize how dry they would get. Like I remember my hands just cracking and just hurting so bad.
That's all the questions we have so far. So I'm going to pull up some closing items. And during that time, please, if anyone else has questions or comments, please drop them in the chat or the Q&A tool, or drop them in the chat or using the Q&A tool, or you can raise your hand if you'd like to ask your question out loud.
And can I send you links to send out about the C. diff and the hand hygiene, because it does get kind of confusing, and since the CDC doesn't take a stance on it, one or the other, then I like people to just read it and have that information available to them.
Absolutely. Yeah, so wherever I post the recording, I'll post those links too, and I will be emailing the presentation recording and the slides to everybody who registered, so I will include those links when I do that. While we're waiting for people to put in their questions, if anybody else has any, I'd like to invite everybody to next week's webinar, which will be on antibiotic stewardship. So that will be at the same time and place next Wednesday at 2 p.m. We invite you to bring your questions to our virtual live chats every Tuesday and Thursday at noon. One of our quality improvement specialists will be there to answer your questions on topics such as quality improvement initiatives, infection control, or MDS coding. You can find the links to our live chats and webinars in the newsletter we send out every Friday called the Last Minute Lowdown. And if you'd like to receive that newsletter but don't think you're on the mailing list yet, you can email me at caudill@qualityinsights.org and I will get you on that list. Now let's see. I'm going to look to see if there's any more questions. There are not so far. Ericka, is there anything else you would like to add before we wrap up today?
I don't think. I think I said as much as I can.
Great, thank you. All right, if that's it, I think we can go ahead and close out today's meeting. And I'm sorry I couldn't get that video to play, but again, I'll include the link to that when I email everybody later this week. Before we sign off, we'd like to ask everyone here to please answer a short evaluation of today's webinar. It is anonymous and will show as a pop-up as soon as the webinar ends. So if you have a couple minutes to fill that out, we would appreciate it. Ericka, I'd like to thank you for joining us today and for this great presentation. And I'd like to thank everybody here for joining us today and hope to see you again soon.
Thank you.